So Ray, you've had a lot of operative treatment as well as non-operative treatment.
Yep.
Can you tell us a little bit about how the non-operative treatment has let you run and meet the expectations that you wanted after surgery?
Well, yeah, as an athlete now for many decades, unfortunately, things sometimes start to hurt, and I've had some hamstring, hip issues, maybe not related to my back, but nonetheless they're there, and it affects whether or not I can compete at a high level. And I want to compete at a high level. Unfortunately, it's the treatments you've been able to do on me have brought that pain totally, in many cases, totally away. Sometimes manageable for a while, but it ultimately we've been able to knock them out, and that allows me to be consistent with my training. So definitely, it's great to know that every time you hit a pain, it's not headed towards a surgery. There's definitely lots of other things that can be done.
And the treatments that we've used have both been with steroid, but a lot of it has been in the regenerative medicine world with platelet-rich plasma. Can you tell us a little bit about why you decided to go that route of using platelet-rich plasma instead of the traditional methods of steroid-based injection?
Well, based on everything that you all have learned and my own research, it just makes a lot of sense. The procedure makes a lot of sense, and when there's a place that you trust, and it makes sense, it's a real easy way to just go ahead and give that a shot. And certainly it worked really well, and the downtime wasn't that great, and that's for an athlete. Athletes like to hear that you're not going to be out of commission forever, and so that combination of knowing that it was effective, and that you all could educate me and I could educate myself and come to that conclusion, and know that the downtime wasn't so great was useful.
I think it's so important that with many of these traditional methods of steroid-based injection, they'll help you for a few months. But somebody who's such a high-level athlete like you are, you really need something that's going to heal it naturally and get you back to doing what the type of things you want to do. Instead of treating it in a palliative method, just treating the symptoms, treat the underlying cause and the underlying pathology, so you can actually get back to this for years on end instead of months or days on end.
Exactly, and I also think that allowing yourself to go through a procedure like PRP, and knowing that there's a post-treatment protocol allows you to take that pause, get the treatment, and then actually do the exercises that don't just put a Band-Aid on things. You put the Band-Aid on and you fix the underlying problem. So it's nice to have that whole package, and especially when you can come someplace where everything can be done all in one place.
Yeah, I think with spine and orthopedic issues and pathology, both surgery and non-surgery together really lends the best for a patient. It really kind of gives you the best outcome.
It does, absolutely, because then you know everything is on the table, and every time there's an ache or pain, you don't have to freak out that it's the end of the world. You just calmly approach it and discuss it, and knowing that there's most of those situations are going to be handled operatively, and on you go with your life.
Great. Yeah.
It's pretty natural, whether you're an athlete or not, to have aches and pains as you start getting older. And most people ignore them because they don't know what to do. And I think most people fear them because they think it's going to lead to surgery. Whereas if you can have confidence that there's going to be, for many of those situations, there's going to be something that can be done that is within your time schedule, that is within your budget, that is within your capabilities. If you stay on top of it, then you can have a longer active life without compromising what you want to do, just by staying on top of things.